kind of looping this back to some of the treatment work that like Beck's group does. Greg Brown, in his work with Tim Beck, has done this really nice model where they, at the end of their 10 sessions of cognitive therapy, they do a relapse prevention test or technique where they actually do guided imagery. And they sort of walk the patient through the triggers of what led up to their suicide attempt. And then they invite them to sort of respond differently. And the way I think of it is you're rerouting, in effect, sort of a stimulus-response pattern that it's like you have a way of driving to work every day, and you've driven it for 20 years. And the road may be filled with chuck holes, and it's a bad neighborhood to drive through, but it's the way that you go. And then I say, Lisa, I've got actually a much quicker way to get there and a much smoother road that's not a dangerous neighborhood. Why not try this way? No, I like my way. And so that's human nature, but if a skilled psychotherapist can sort of train somebody to try a different way and sort of practice it and rehearse it and help them, if they get lost, find the way, I'm certain that there's probably an fMRI study in there someplace that you just basically rerouted the neurobiology of an established series of impulses, at the neuronal level, and clinically and overtly, what you see is that somebody can really learn to drive a very different way, even though they thought there was really only one way to go, or they're very comfortable with the way they've always gone. That's what we're trying to do with suicidal people, and their study shows that when you develop this skill set, that they can reduce recidivistic suicide attempts by half, which is just a spectacular finding, and I think gives a lot of us great inspiration that you don't have to do 5 years of psychoanalysis or ECT or something really dramatic to get even a relatively high-risk individual into a significantly different place.